Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everybody. Welcome to the Health Hour, and on this first Saturday in August. Yes, we're in August already, and I have the great pleasure of introducing Dr. King this morning, and she is the shortened version is a neuro rehab physician. There's lots and lots more words involved in what she does, but she's very, very skilled. So I am really, really delighted to introduce her today, and she's going to talk about spinal cord damage. So please welcome and listen. And if you want to tell us where you are, just put it in the box. And if you've got any questions, put it in the box and we'll answer them. We'll address them later on. Thank you very much. Over to you.
I will just share my slides and hopefully you can see them.
Yes, we can.
Okay. Thank you very much for that kind introduction. This is a particular area that I work in. I work with, in new rehab, it's essentially the brain, the spinal cord, and the nerves that go to the rest of your body. So today I am very, very pleased actually, and thank you very much for inviting me back again to come in and talk about and have this discussion this wonderful sunny Saturday morning. So spinal cord injury is reasonably common enough, I think, that to make it a topic of not only interest in the initial treatments of it, but also in the follow-up treatments of it. And also, actually, it is worth noting that it is a global problem. And actually, which means that it not only it doesn't affect specific groups of people, but it affects all of us, actually, or all different humans. So today I thought I will talk about, just to give a small overview of the extent of the problem, in terms of it is relatively common, and also the impact it has, and just have a little overview of what is it. When you talk about spinal cord injury, what is it, what causes it, and how does it affect individuals? And for those people that are living with spinal cord injury or supporting individuals or family members and loved ones with spinal cord injuries, what are the things to think about and to consider? And then further to that, resources that are available not only within the formal sector of the national health system, but also outside that. So just a few key facts as just a very small overview. worldwide, spinal cord injury actually affects it is estimated that currently where we are now, about 15 million people live with spinal cord injury of one type or another. This actually is statistics from WHO that was, I think, 2022. So it is probably estimated that a whole lot more people than that initial estimation is. Most spinal cord injury cases are due to trauma, and which is probably when people talk about spinal cord injury, most people will think of trauma causes, and that is because it is the most common cause. And the reason why I highlighted it as well, that if most cases are caused by trauma, then they are potentially preventable. And when we talk about trauma, it could be anything, such as simple things as falls. Actually, it is incredibly common, falling from ladders, falling from high heights of different types. And then road traffic injuries. And road traffic injuries are usually not only up to just the individual, but it is also usually to the laws of whichever country that they're in around speed and everything else. And another thing that we have to think about as well with spinal cord injuries is violence-related incidents when we think about the traumatic causes. There are other causes of spinal cord injuries, which I'll talk about a little bit more when I specifically talk about the spinal cord itself. And then, but in terms of key facts, we have to then think actually when you have a spinal cord injury, specifically related to its structure and how it functions, depending on the extent of the injury, it can be quite debilitating. And in some instances, it can be life-threatening and sometimes actually be the cause of mortality. And other times, actually, it can give you secondary health problems that relate to a spinal cord injury. In younger populations as well, because I specifically work with adults, but there is also the pediatric population as younger people that have spinal cord injuries of different types. It has been found that it is associated with lower school attainment and lower school education attainment, which then in turn actually leads to them not participating in economic activities as they would otherwise have done. So I suppose I would say that, but I think you might also, I'm hoping that you might also agree that then it makes it worthwhile that it is a problem that we would wish to not only prevent the preventable causes of a spinal cord injury, but that we would strive to get the right treatments and the right rehabilitation if an injury has occurred, and also be really aware of the ongoing health problems associated with it so that you can reduce the impact that it would have on individuals' lives when they've got it. So when we say what is a spinal cord injury, really, how is it defined? So a spinal cord injury is when, if you think, I'll talk about the structure of the spinal cord. I like to think of the spinal cord as you have to think of the bones, which is the spine, those bones that are stacked, from top to bottom to your tailbone. They are there really to protect the very delicate structure that runs from the brain all the way down. And when we say an injury has occurred, is when damage has occurred to that cord that is in the middle, leading to it not functioning as it normally would, and then affecting its usual function of actually transmitting signals between the brain to the rest of the body. So in my work, I suppose that's how I would simplify it so that I can think about it or how it works. I think of the brain as being the mastermind, if you like, or the chief command, and then the spinal cord being the second in command to the brain. So you get the brain, as I've highlighted, well, I didn't do the picture myself, but as somebody has beautifully put that. So you can see that is the back of the brain, actually. And then you see the spinal cord right there, absolutely connected to it. And then it's a very delicate structure. As I said, it is enhanced in those bones. That is just the neck part of it. This was using it for illustrative purposes. When you go to see health professionals, we tend to use short-hand language that is historic, and then people just tend to use it. So people would refer to the cervical region of the spine, meaning that that's just the neck region. The thoracic, we referring to your chest, upper chest, and maybe just up to your mid-back. And the lumbar region is the lower back. And then the sacral is really towards your pelvic area. So you can see there, that's sort of like a cartoon illustration, which then links. So the spinal cord and the nerves that come out of it link to the functions that they specifically do. So you get the spinal cord, as I said, which runs in the middle. Then you get the bundle of nerves. I'll just go back quickly here that come out. I don't know if you can see these little things that are labeled that come out of the spinal cord, and they go to different parts of the body. So each spinal root, just to again make it easy for us, is that when we referring to kind of like the cervical or the neck area, we then name them in numbers to say C1 up to C8, because there's nerve roots from 1 to 8 that come out of your neck before they subdivide to various parts of your body. Then you get the thoracic area, as I mentioned earlier. So the thoracic nerves, again, are named both sides, 1 to 12. And the lumbars, you can see again, that they're named 1 to 5. And the sacral, which is your tailbone, the nerve roots coming out of it are named 1 to 5. This is just a kind of like an overview or a bit of a summary of what they do. That C1 to C8, you can see there that they do quite a lot of the upper body related functions, things that are around your head and neck control. And then they go to your diaphragm, which would affect your breathing, and then some of your upper limb muscle function and how they work. And then you can get the chest areas, all the muscles that come out of the thoracic area. Some of them go to the chest and some of them go into your abdomen, and they control the organ functions of those areas. And then the lumbar, I always remember lumbar very easier, because lumbar, lower back, and leg muscles. So most of the nerves that come out of that would look at the leg movement, sensation, to all those different parts. And then the sacral part of your nerve, which usually there's a tail. It's kind of like the spinal cord comes out, and then it comes out in kind of like what looks like a horse's tail, nerves towards the end. And they're the sacral nerves. They come out in a bundle. And they control your bladder and bowel function, and predominantly your sexual function. You can, I hope, appreciate that if you get a higher level injury to your spine, if it is the higher up it is, the more likely other nerves might be interrupted. So if you get an injury around the neck area, if it is a complete injury of the spinal cord, it means no messages whatsoever go below that area. If you get an incomplete injury, it might mean that some of the signals might still go through. I can explain that a little bit more if you like. So what causes the injuries? I've touched upon a little bit of the traumatic causes in terms of trauma. As we all would appreciate, trauma means when something with a certain amount of force hits or encounters something to such an extent that that force causes an injury. And this can happen, of course, as we mentioned, in road traffic accident, if you fall. And sometimes, I know I mentioned that if you fall from certain heights, say from ladders, from climbing something else, or that sort of thing. Sometimes lower height falls might cause an injury. If you fall and actually maybe say your neck hits something of resistance or force. We've had patients that maybe you fall, as they fall, they hit the side of a table, and that causes additional trauma. And or if you've got some previous, I would say maybe you have osteoporosis for instance, as in your bone strength is not such that it can withstand some amount of force, and then you might cause injury. Violence might include, probably less so in the UK, you don't hear about it as much, but in other countries where there's lots of gunshot wounds, but we still do get some here. And also knife crime, sometimes people with really reasonable, quite a lot of force, you can injure the spine. And in some other parts of the world, as you'd appreciate, where there's wars and everything else, then you do get quite a lot of traumatic spinal cord injuries. Non-traumatic causes, if you get an illness that then affects the spinal cord, for instance, the reason I've given that example of cancer, you can get cancer that actually, if it affects the bone structures that are around the spinal cord, it might actually cause those structures either to be weak, and then you get a injury where the bone itself actually ends up pushing into the spinal cord. Or sometimes when people have really bad inflammatory arthritis that then distorts the structure of the spinal cord, you might actually get the discs that are in between might also end up pushing and then into the spinal cord and maybe pressing on it a little bit. Something relatively common, I've seen quite a few people with this actually recently as well. It's slightly on the rise at the moment. Tuberculosis is, as you know, it's an infection that could affect. It's more common. People are more aware that it can affect your lungs, TB, because of the cough. But TB has a tendency to sometimes just go to the spinal cord. The spinal cord inflames, it swells up, and then obviously it will not be able to do the signaling that it needs to do. It's not just tuberculosis, there's other infections that can do that, including viral infections. You can sometimes get autoimmune illnesses that some people might have heard of, transverse myelitis. Transverse just means something longitudinal. Myelitis means that there's inflammation of that spinal cord lining, which then interrupts how it works. As we all get older, if you're really fortunate enough to get to a certain age, you might get what we say is degenerative. Just over time, the discs that stay between those bones that stack, they just get less and less over time. And then you get less space of those nerves coming out, and you get spinal stenosis. And then some of the discs press onto the spinal cord. So this was just to try and illustrate it, to say anything that disrupts the structure of the bone. So if you see this yellow thing on this cartoon being the spinal cord, and this white bit here being the disc, if anything that disrupts the structure, whether it's trauma or anything, it means that possibly you can get injury to this. And the bone structure, or the protective structure, can be disrupted by trauma, and as I mentioned, by illnesses such as cancer and other things that might, if it's gone to the bone, and might disrupt that. Transverse myelitis, I thought this is worth a mention because we've seen this quite a few times, and it's relatively actually more common than some of us think in our in Black and Caribbean, Afro-Caribbeans, or Black or people of Black ethnic origins, where you get normal spine here with the linings, but then what you can then get, I don't know if you can see this very clearly on here. Let me move this so I can see what I'm pointing at. Then you can get inflammation on some areas, and that inflammation is usually sometimes caused by autoimmune processes. I mentioned earlier that we try to categorize the type of spinal cord injury into relatively two categories, which are broad. If you get complete spinal cord injury, that usually means that it's more common in trauma, where trauma has been such that the spinal cord itself has been completely cut through or injured all the way throughout at whatever level. That usually then means that anything below that no longer has any access to messages coming from the brain. So any complete injury, if it's complete injury, it means there's no signals that are getting through from the brain to any area below that. So sensation and muscle movement will be completely affected and impaired. Incomplete spinal cord injuries means a partial injury. So if you think part of the segment is affected and there's still a way that signals from the brain can go to the area that is not injured. So then anything below that level of injury can still get some level of function because they're still managing to get some messages through. So some sensation might be preserved and some movement might also be preserved. What are the immediate signs or things, clues that might make you think, I need to think about what is happening with my spine? Sometimes if people have really severe pain or pressure in any areas of that I was showing you there, that the neck area, which is the cervical, if you get to the thoracic area, which is your upper back and a little bit of your mid back into the abdomen, and then if you get lower back, and that is pain usually has to be differentiated. And by differentiating, I mean, there's many reasons why any individual can have pain. You can have pain because of muscle and difficult, any muscle injury, any ligament injury, any other organ-related injury. But some signs that usually imply that you just need to get a health professional involved to look at it a bit closely is that if that pain is of such excruciating pain that you're thinking, this is new, I cannot explain how I've got this, or I can explain that I was playing sport, but the pain is not going away. It's an unusual pain. We call it neuropathic pain, where it travels. And if it travels, you're thinking it seems to be going along some nerves, especially some people get pain that then from the back seems to travel to the front. Or particularly if you get, even without pain, if you get unexplained weakness and or unexplained in coordination, or if obviously a paralysis of any part of the body, that needs to be looked at. And the reason why I say this, if you remember what I said from the beginning, where I said the brain is the mastermind and then the spinal cord is the second in command, with all the nerves then coming out to go to different parts of the body. It's kind of like the foot soldiers, if you like. So if you have weakness in coordination, paralysis of any part of the body, what you then have to wonder is, what is wrong? Is it messages in the brain? Is it something that's happening in the brain? And or is it actually related to the spinal cord that it's not getting the messages to the right places? Or is it a problem with those nerves? But to tease out what exactly is the cause of any of those things, usually it would be best to get a health professional involved in this. You can get numbness, tingling, and loss of sensation in any part of the body for various different reasons. It may not necessarily mean that you've got a spinal cord injury. It might mean that actually maybe you slept a bit awkwardly and then pressed on one of the nerves, and then so you've got tingling in your arms and legs. Some people have had where you get tingling nerves in your hand, mainly because one of the nerves that comes out here, there's a bit of swelling around it. But if it is persistent, if it follows a certain route, again, get a health professional to look at it and be able to differentiate what could be causing that. If a spinal cord is established, the longer term, when I put long-term symptoms, these are things that persist. If you've had loss of movement that has persisted, loss of sensation, and by that you can get numbness, you can get things like where you don't feel heat or cold, or you can't differentiate touch. And some people might notice things like changes in their bowel and bladder function, their ability to pick up that they need to go to the loo or have control of either one of those functions. Again, big topic that probably also needs discussion in itself. You can get pain or this really intense tingling sensation that's neuropathic pain. The pain is some people might either have supported people to go to the doctor or might have gone to see other health professionals themselves. And a lot of the time people say to you, if you say you're having pain, they try to get you to describe the pain. Is the pain dull? Is the pain this? Is the pain this? Is to try and differentiate that, because nerve-related pain is quite specific. People usually describe it as very annoying, quite difficult to describe, but kind of like with a sharp, sometimes radiating, a bit like electricity type pain. If, of course, the spinal cord is an injury, or if the injury is a bit higher up, just to go back again, the cervical, which are the nerve, which are the neck area related nerves coming off the spinal cord there, they go mainly, as I said, the higher up it is, they go to control your head movements, they go to control your arm movements. And if you remember, I mentioned the diaphragm. So the diaphragm is it's this big muscle that separates your lungs from the rest of your abdominal contents. So if nerves that go to it are not working, then breathing will be very difficult. You'll not be able to cough. You'll not be able to clear some secretions from your lungs. So anything that affects the spinal cord around the cervical area, where one of the diaphragm nerves comes out, or anything that is in the thoracic, particularly the upper thoracic nerves, might affect breathing, coughing, or clearing of lungs. Just going back there, I thought at this point, I'll just bring back that illustration again, just to say there, the neck nerves there, and just to show you that any injury in those, if it is complete in those cervical and or neck areas, that is the level of where everything will be affected from. Thoracic injuries, anything from all the way there would affect things from just above, just under your, it's easier to kind of nipple area if you go and all the way down. Paraplegia is saying two limbs are paralyzed. And again, lower, you will still have sensation, but it really loss of sensation and muscle start here. The quad equina, I'm terribly sorry because I don't think you can see this very well in this thing. So you can see the spinal cord coming down, yellow, all the way down. And then towards here at L5, it fans out into a bundle of nerves, which I've said look like horse's tail, hence the expression quad equina, which apparently means horse's tail for the Latin speakers amongst us. And that is where, if sometimes you hear people saying it's a very low spinal cord injury and it's mainly a quad equina, they mean that it will affect sexual function, blood and bowel, give you some lower limb weakness, but might not give you total paralysis. How do we determine what extent of the injury is if you come to hospital? The usual thing, we start off with the history. I should have put that as in, what are the symptoms? How have they affected you? What has happened? Of course, in an emergency situation where somebody has fallen off a bike, been in a road traffic accident, and or people that are in war zones, usually go straight into physical examination, what is happening, and then going into imaging. Where things are developing a little bit slowly, that's what I'm meaning by getting the history from somebody about what has happened. And then there's different types of tests that are done. They look at very different things. Imaging tests look at, the x-rays are very good at looking at bones. What's happening with your bone? Do you have what I was describing earlier as degenerative changes? Again, if you're very fortunate to get to a certain age, over time, have the discs worn out? Has the structure of the spine changed? And how is it affecting it? And or is the structure of your spine so particular that actually it's giving clues to conditions that you might have that affect your bone? The MRI, which just means magnetic resonance imaging, usually gives a lot more detail. It's a test that takes a lot longer to do. And it usually takes, I think people stay in a scanner for maybe sometimes 45 minutes or even longer, depending on what you're looking at. A CT is used it's a brilliant imaging technique that would give you a very quick look to see what's happening with bones and injuries, particularly useful in emergencies. This is a very detailed way that we do examination to really get an idea of classifying what type of injury you are. The reason why I put it up is that just to give you an idea again, that we try to match the symptoms and the signs that you have into the level of injury. Why do we do that? Because then it gives us an idea of, is the injury complete? As I said, have you had complete injury of the spinal cord? Is it incomplete? If it's incomplete, to what extent? What signals are still going through? And or actually, maybe on detailed examination, following your symptoms that you've had, maybe this doesn't actually seem to be a spinal cord injury. Maybe this is a different illness altogether. I don't know how visible this is. This was just to show you the detail that an MRI can provide you with, that you can see the bones that are stacked. You can see here in between them, the discs. And here you can see that there's an injury here because the structure, something has happened to push the spine right in so that it's pressing very hard against the spinal cord. So messages that are and signals that are coming from the brain to come all the way down here will be interrupted here during this injury. So then we'll think about management. So after you've done the history, the tests and all the imaging, and then you've determined what kind of injury it is, what are the treatments that you do. And then I should mention that the other types of spinal cord injuries that I mentioned that are not trauma, where you're thinking, is this an infection? Is this an autoimmune process? There's other different tests that you would do. There is numerous blood tests of very detailed nature. Further to that, what we would usually do, and that those are my acute neurology colleagues would do, is take a sample of the fluid that runs around your brain and your spinal cord, CSF fluid, so it's cerebral spinal fluid, to take a small sample of it and then send that to specific labs to look for infection, to look for antibodies that might give a clue if you've got an autoimmune process, and also to look at different things that might add you. Is this a viral infection? What is the balance of that? So that would also need detailed looking into. Once you've determined what is the problem, then you look at how do you manage it. The initial management, of course, of a traumatic one is you try to immobilize the person in the immediate time, if it's trauma, because what you're trying to do is, until you've had full imaging, until you've decided whether they need surgery or not, they should not be moved around. So if you are somewhere and then somebody has a fall, before you try to help them to move, unless they're obviously in a dangerous place, if they've fallen onto the middle of the road and there's traffic and you try to stop traffic, but usually ambulance people are able to move people, stabilize them properly. And then the further to that, there's a way that surgeons can, in operating, try and stabilize those bone structures so that they don't continue to cause further injury with movement. You then, of course, have to manage pain, and then there's different medications that you'd use if there's swelling of the spinal cord to try to bring that swelling down. And some of those medications might include high-dose steroids. And as I mentioned, surgery, where you either, in trauma situations where you're removing bone fragments, any other objects, because otherwise, if you don't do that, they will continue to press on the spinal cord in different areas and cause further injury. And in people that have autoimmune problems, you'd obviously look at various different detailed treatments on how to manage that. At some point, of course, you might then say, right, this was the initial injury. Was it a traumatic injury? Was it an autoimmune process? Was it an infection? And I forgot something else, actually. The spinal cord also, like any other part of your body, has its own blood supply. There's blood vessels that go to the spinal cord to supply it. And if that blood vessel is blocked for whatever reason, you can get an injury to the spine, which is a spinal stroke. Once you've determined the cause, once you've stabilized the process, you then look to see how much recovery are you going to get? And then how do you work around that? And also, in some instances where you cannot recover function. You can't get the spinal cord to recover because it was either severed so much or it had so much inflammation that it's got scarring. How do you work around that? And I like to say that neurorehabilitation is a team sport, which if you can, with the Olympics in mind, think of any team sport of your choice, or you can even think of football and other things that, you can get very brilliant individuals in it that are excelling in their own right, but you need to work in coordination and communication so that the physical therapies that are needed to maintain and or build muscle strength. Physiotherapists usually do that, and they work along occupational therapists that would also look at specifically, particularly very intricate muscles function alongside looking at daily function. How do you live now with the spinal cord injury that you have? There is various different things that you then look at. How are you going to, if you have impairments that are not reversible, how are you going to live the life that you would like to live? How do you do the things that you want to do, whether it is education, whether it is work, whether it's family life, whether it's contributing in volunteering or doing other things. And there's various different technical things that people beyond wheelchairs and or braces that they have. There's also new assistive devices that are electronic. And we mustn't forget really that the mind and body are not two separate things. What happens to us in any given time, particularly something as devastating as a spinal cord injury potentially, will affect how we view things for some time and how we view the future. And so psychological support will also be needed. I just wanted to mention that at this stage of rehabilitation, there's numerous different neurorehabilitation centres across the country. And there's also some specialist spinal cord injury centres that where most of the kind of like rehabilitation that is very specific to spinal cord injury, particularly for people that have the more complex spinal cord injuries that are, as I mentioned, if it's something from the neck down that also affects your breathing, that you might need tracheostomies and you might need other very complex care. There's only 12. I was going to say 10 and then thought actually it's 12 if we include Scotland and Wales. And as you can see, they're dotted across the country as you can see them there. But really, strictly speaking, I think my colleagues that work in those centres would say that we need more of them because there is extraordinary waiting list times for people to get into those centres. And there's other neurorehabilitation centres that we work in jointly with them. I'm based at King's College Hospital, so we work very closely with the Stanmore Centre, which is based at the Royal National Orthopaedic Centre. And then we also work with, I always forget the other one actually. Hopefully somebody can let me just try and see, because I work quite closely more with Stanmore. There's another one in Southeast London. Have I forgotten to put it here? Anyway, so there's two centres actually that serve London. So, but for the very complex spinal cord injuries, they have to wait to get into those centres to get the very specialist care. For individuals that live with spinal cord injury, again, depending on the extent of it, their daily challenges really, there could be mobility issues. If you are paralyzed, if you have paralysis of all your 4 limbs and also paralysis of the muscles that manage your breathing, depending on the extent, some people might have to live with a tracheostomy. If the muscles of your breathing are not as affected, but you still have to manage breathing and maybe coughing, you might have things called cough assists that you can use. Other individuals might have preserved upper limb function, might have to have there's various different types of wheelchairs, depending on somebody's needs. So it's very technical in terms of what wheelchair services can provide. Depending on how much your mobility is affected, you might need, understandably, care support with being able to move and change position in bed, being able to get in and out of bed so that you can get into chair or you can leave the house. And some individual might need up to as much as 4 times a day care with 2 individuals, as well as night care. Because it is very important to be able to move and change position, because if you stay in one position in one place, I'm terribly sorry, somebody's knocking at the door. Let me just I'm so sorry. Lara, come down, please.
Okay. Thank you, Dr. King. Apologies, I had to mute you.
Hi, Dr. King, you're muted. Sorry.
Hello, hi, I'm back. I'm so sorry. Can you hear me?
Yes, we can. It's all good.
Yeah.
Thank you.
My sincere apologies. I thought, I think this lady made good time and got here before 12. I had thought it was after 12, but my son will attend it. The usual challenges of being able to do something from home. So to pick up quickly, so I don't lose that much time. So the daily challenges of mobility and reliance on assistive technology, and as well as other individuals that might help you. The research has shown, which has been done time and time again, where people have looked, health professionals have looked and spoken to individuals with spinal cord injuries, and they've said to them, what is the thing that has the biggest impact in your daily life, in your social life, in being able to access the community, go to restaurants, go to the park, go to do things, see your family, friends, go to work? What is the biggest impact? And people said, is their bladder and bowel management. That if you've got a good wheelchair and good transport, and you've got ramps and other things to access buildings, the thing that will stop you going or doing things that you need is the fact that if you're not sure what's going to happen to your bladder and or your bowel at any given time, that will keep you in the house, or it will keep you in a place that is close to toileting facilities. So that is a very important thing. So getting that right with the health professionals that have special skill set with that is something very, very important. To manage bladder and bowel, usually the specialist nurses with specialist skill set to do that, because it takes time to get that right for each individual person. And then further to that, you also work along with rehabilitation physicians like myself, because there will be various different things that we trial and work with. And then further to that as well, you might need an individual might need further investigation and looking into how that bowel is working, and there's investigations that can be done. And those can be done with other specialists. There's urologists for the bladder, and specific tests to look at how is your bladder functioning, why is it behaving in a certain way, and what needs to be adjusted. And for some people with their bowel, it can get to a point where you need to have some other interventions, and we work with colorectal surgeons to that. Another very, very important aspect of having a spinal cord injury is the skin care, to particularly prevent pressure sores or the skin breaking down. Going back to saying you need repositioning regularly, you need skin checks regularly, because particularly if the spinal cord injury that you have has resulted in loss of sensation. Because if anyone without a spinal cord injury, if you sit in a particular position, you fidget, you move, you change position, because sensation, those nerves are feeding back to your spinal cord. Say too much pressure, too static for some time, then the brain automatically, you move and change position. For people, as I mentioned, that have higher level injuries, there is very specialist respiratory care. In Southeast London, we also work very closely with a centre that is Gus and St Thomas's Centre, that is called the Lane Fox Centre, that looks particularly at people that have various respiratory problems that require tracheostomies. So that might require that level of care. So other things that people might have to think about and consider, depending on the level of injury, is where are you going to live, and where do you live? Is your current home? Can there be modifications? Occupational therapy colleagues are trained to look at home environments, measure it, and look at what adaptations can and cannot be done safely and or not safely, and do recommendations from that. And usually, before you leave a rehabilitation center, they might also do a joint home visit with yourself, with an individual with spinal cord injury, and physiotherapy colleagues to work together to look at those various things. And of course, with some of the adaptations, some of them, depending on the extent of them, sometimes it might include things like, is a wet room the best thing really in order for somebody to maintain their hygiene and personal care? And that might need various other organizations to get involved and in that manner. The other thing that people would think about, returning to school, returning to work, returning to other activities, whether they are, if you're the person that is the stay-at-home adult managing the household and doing all of that, so there's vocational services for that. Unfortunately, as these things go, it would be brilliant if we had vocational services that people didn't have to wait for a very long time for, but sadly, actually, the waiting times are quite lengthy, which you should, in the spirit of trying to keep people either in work and or in activities that they want to do that are meaningful to them, is sadly not as responsive. There are individuals with spinal cord injuries have really highlighted the extraordinary benefit of peer support groups, and there's a few charity organizations that are specific for spinal cord injured individuals, and have volunteers and peer support workers that have spinal cord injuries themselves, and they're able to really give valuable support and very specific good information about living with a spinal cord injury. And one of them, in fact, is the Spinal Cord Injuries Association. This is just a screenshot from their website. It has very, very helpful information about your health in terms of, if you've had a spinal cord injury, understanding it, skin, exercise, nutrition, aging with the spinal cord injuries, because what has been since found is that it's not a static condition. It actually changes over time. And there's monitoring that is needed. And very, very specifically, what are the health risks associated with different levels of spinal cord injury, particularly a condition called autonomic dysreflexia, which affects anyone with a spinal cord injury that is T6, so thoracic level 6 and above. And at that level, your spinal cord and the nerves associated with it lose the ability to respond to any injury below that, the spinal cord injury. So anything below T6, if you have a complete injury particularly, your body's autonomic or automatic way of responding with the blood pressure, your pulse, is lost. So if you have something that is injuring below, like for instance, if you have the catheter is blocked and or you might have a really painful injury below that, your blood pressure can go dangerously high. If you're at risk of that before hospital, an individual with a spinal cord injury will have been informed of that. I know this would be evident to most people that, as I mentioned right at the beginning, that the most spinal cord injuries, most individuals living with spinal cord injuries is as a result of traumatic spinal cord injuries. So I'm now thinking the future, what can we do to bring that down? The safety measures, legislation in each country, protective gear during sports, and also being very safety conscious, because as we know, some devastating spinal cord injuries actually has been as a result of people diving into shallow swimming pools or shallow bits of water, and fall prevention strategies, violence prevention. What is the future? My colleagues that are research workers are looking at, as I said, it's not a static disease. How can we prevent further degeneration or further injury with time? Get often asked about stem cell therapy. It is very early trials. Just for interest, stem cell therapy it's where individuals after a spinal cord injury, some specific cells are taken from the abdomen, and then reintroduced to the spinal cord to see if they will regrow into neurological cells and or link up in order to repair enough that some function can start being established. I think very, very early trials, some of them in the States, have shown some promises, but it's not common practice yet. There are some neuroprotective drugs very early on in any type of spinal cord injury. As I mentioned earlier, things like steroids and steroid-sparing drugs to try and bring down swelling as early as possible. And in some instances, things that are really advanced technical things, prosthetics and robotics. People might have seen this being showcased where people are able to stand, but with a lot of support from very advanced robotics. So in conclusion, just very quickly, sorry, I know I rattled through a topic, but I thought I should give opportunity to answer a few questions, is to talk about the Spinal Injuries Association. It has extraordinary amounts of resource on it. And there is also a society called Backup, and they look at and support spinal cord injured individuals that are wheelchair users. So if post your spinal cord injury, you have to use a wheelchair and need to use a wheelchair for mobility, they use various forms of trying to get people to be able to do all the activities that they can as far as their interest allows them. I will stop now so that I can have opportunity to maybe answer some specific questions that people would be interested to hear more detail on. Thank you very much for your time.
Hi, yeah, thank you so much. That was absolutely brilliant. There's just so much information there. And I think I was anxious at first that it might go over my head, but thank you for showing us in such a way that it made sense. It was easy to understand. So thank you for that, Dr. King. So I was just reading some of the things in the chat box. Marcia said, I was told that I have 2 slip discs in the lumbar and also trapped nerves. My legs are weak and I find it difficult to walk. And I've fallen a few times. When I'm falling, I can't stop myself. I have continuous pain in my body, especially in the back and left leg. Also shortness of breath and numbness of the body. And I was told, I need an operation. Is this my only choice? That was a lot of information.
Yeah, I think that I'll just say with caution, not knowing the full story, but I think if you've been assessed and they have recommended an operation, it usually means that the first 2 measures of trying to get the discs to be less swollen, which is usually you try to do steroid injections, anesthetic injections. If they are saying an operation, it usually means the compression is such that they need to decompress, because it sounds like if you're starting to get weakness and the other signs that you're mentioning, I would say consider it, but have a discussion about what does the operation involve. Is there different types of operation? And more importantly, what are the expectations after that operation? Is it to preserve the current function that you have, or do they think that you might get some neurology back? But the longer the cord is compressed, the more injury it sustains. So if you can have that discussion to get as much detail as to the proposed treatment as possible is what I would recommend.
Thank you. Joy said, I have a condition called, I can't even say that, syringomyelia between
Yeah.
C2 and C4, with most of symptoms described, but not many people know of this. So she was just sort of letting us know about what she has. And questions from social media. Could you tell us more about how people tend to deal with their mental health after a spinal cord injury? And do you believe that mindset plays a significant role in the recovery? And could you elaborate on that, please?
I think just very briefly to touch on the syringomyelia. Sorry, I couldn't cover every possible cause, but syringomyelia is thought essentially, as the individual will know very well, that it's you get kind of like if you like, a sack of fluid, and then it sits, as they've described in their case, between C2 and another C level. And depending on how big that is, because it's a cyst essentially, if it expands, the more it expands, the more it will press on the spinal cord and cause associated problems. In some cases, the way that it is managed is that they would put a shunt in so that it drains and regulates fluid in that cyst. But it tends to reoccur, and it doesn't tend to completely go away with treatment. In some cases, they monitor it for as long as possible, depending on the problems that it is causing. And absolutely right, it is not commonly known. And then further to that, the second question addressing mental health. When we look at mental health and psychological effects of the spinal cord injuries, I would say that if it is not addressed and you don't get the right support, I can see how it then affects how people advocate for themselves to get the resources that they need. And also they end up doing less and less. And then if you do less and then you're not advocating for yourself and you're not getting the information of how to maintain your health in the longer term, those individuals, yes, don't do as well as somebody who has the right support, advocates, and then has the right health information and optimizes their health.
Thank you. Another question. I've heard that sports like rugby and boxing are prone to spinal injuries. What is your opinions on children practicing such sports?
I would say the rugby union and other sporting have recognized this. It has come up a lot. And in fact, it is because the rugby union, some people might be aware of this, they have an established fund post if a rugby player is injured. They have a rugby union injuries association that assists that. So with children, I would say that if you have a child who is interested in that sport, you have a conversation with the coach to find out, are they following the rugby union recommendation? Because at different levels, the sport is to be no contact, and then how contact is introduced. So the coach has to be certified with the Rugby Union Association related things. So it's best to get the right information about that. Was there another one that I didn't answer, June?
June, apologies. I believe you muted for some reason.
Sorry, no, that's fine. You kind of linked it in really nicely with that, because mental health it's inherent in everything we do, isn't it? So it's really important that people think about that.
Yeah.
And even the sports, because you're thinking about your children playing it, so it's the future. And do you think economic power affects treatments one can access for spinal cord injuries, or is everything adequately provided by the NHS? And I think you touched on that by saying just previously that if a person's more willing to advocate for themselves, then they probably get more out of the system. Is that right?
Yes. And I agree with that. And I think the reason why I was mentioning those charities is because if you speak to a peer supporter, they're usually individuals that have gone through that have spinal cord injuries themselves and are willing to share their journey, to share the problems that they had, to look at with you from your point of view, from the spinal cord injury point of view, rather than from the health professionals. And yes, the NHS, we are struggling to meet the needs of spinal cord injured individuals. And I think somebody has asked about psychological and emotional responses and how they vary among patients. They do. I should have shared a slide, which is from the WHO, about what determines people adapting as much as possible to any neurological injury. It's their psychological well-being, their sources of strength, whether it's spiritual, it's friends, it's family. If you don't have those structures, consistently what is shown is that people tend to have earlier mortality and more impairment and functional problems.
Thank you.
Was there a question about ethics? Sorry.
No, not about ethics. No, it was. I think it's a lot of the question, because the next question is similar. It's just put in a different way. Like, how do psychological and emotional responses to clinical cord injuries, to spinal cord injuries, vary amongst patients, and what are the effective coping strategies? But I think you kind of just answered that.
Yeah, and one of the things that I will say is that depression comes across in very, very different forms. We forget that depression can come out as anger. And sometimes when that anger is projected, I think it can affect people's outcomes, because you're trying to advocate, but you're angry, you're depressed, and then the articulation of that is very difficult. And then you don't get as much people on your side, which I think health professionals, we're human, but we also struggle sometimes with, if we're trying to manage that, which really ideally we should all have psychologists in those centers, because they have a specific skill set and to kind of like manage that. But it is to be mindful, and if you have family around you, and if there's so much anger that is projecting, if you have other people that can then maybe help and be part of your health professionals meeting, so that you all get the information, they advocate and you ask, would make things much easier.
Thank you. You were right. There is an ethics question. What are ethical? Oh, somebody's saying thank you very much for your presentation. A few people have said that it's been really useful and insightful, and for being so explicit in your presentation. And my question's about numbness in the fingers and hands and feet, cold and cramps, especially at night. Would this be anything to do with the spine?
Yeah, I'll go to that in a minute. Just going back a little bit about the ethics. There's clinical ethics that it's really, really challenging, because sometimes you're aware that because of limited resources, somebody is not able to access care at the right time.
Yeah.
Because ideally, people should, if you like, access the right specialist at the right time in a timely manner, because you're aware that it will make their outcomes better. And so that is the ethical bit of it, that you are aware that these needs are not being met because of resource limitation. And in addition to that, the other big global ethical issue that is maybe more personal to me is that actually trauma, which is again the biggest cause of spinal cord injuries, it is even a much, much bigger cause in less economically resourced countries, particularly in Africa, across the continent, that we sometimes see individuals or you try to work with individuals that have really, really gone to a point where you think this should not have happened to this thing, but to this extent, and you think this is quite. And the other aspect of ethics, sorry to go on about this, is quite a big topic in itself. It's housing. Housing is a big factor, because if you imagine that if you live in a flat on the 8th floor and the lift is not always working, you are not going to leave the house, because one day, what if you get stuck outside and you can't come in because the lift is not working? If you have an accessible environment, whether it's a bungalow or a building where the lift always works, you will be able to live with your disability that you have. You'll be able to go wherever you need to go. And then please, so I'll stop. But there's one small thing about, the electricity and bills. I don't know if people were aware of this, that people that have to live at home with tracheostomies or some ventilators, that there was a time when some people were worried about the electricity bills of that. And then I think, thankfully, the government intervened with that. But there's the ethics, it's a huge topic. I could talk about it forever. So I will not go on for that long.
Thank you. Thank you for what you said. It does make us think about, and that's the whole point of these health hours and the Saturday mornings, to make us think beyond ourselves and our families,
Yes.
because we never know when we're going to come across these situations, and some
Yes.
people might be in it now. So it's, your knowledge, it's just wonderful to hear. And just that last thing this person was saying,
Oh, yes. I think that it's tricky to do that without an examination and looking at everything. I think if you can advocate very politely and firmly, but to get your GP to see you in person and discuss that and examine you. And if they're not, if they feel that there's something, because it could be anything, it could be a number of different things. As I mentioned, sometimes these symptoms could just be the nerves themselves. It could be a problem with the nerves. Is there compression at your wrist somewhere? Is it your lower back? Is it that you have a condition that makes you, that affects it, and it's not necessarily the spine? But you're absolutely right that if it is spine, it's time sensitive. So get to see your GP, not over the phone, but if you can, persuade them to see it in person so that they can look at it and see how things are.
Thank you. If anybody, are there any more questions? Anybody want to unmute themselves and ask? Because thank you for answering the question so well. Thank you so much. Because it's a
Thank you for having me.
even myself as a clinician, I think it's a very complicated subject. But thank you for being able to for giving us the answers that we're looking for and things that we hadn't thought of in a way that just, I think everybody can understand it today. So thank you very much for that.
Yeah.
I don't think there's any questions from anybody. Okay. If there's no more questions, then I just want to say thank you once again. Very much. Thank you very much once again. And I will hand over to Natasha to close the program. Thank you, Dr. King.
Thank you. Thanks very much. Thank you.
Okay, bye-bye.
Thank you so much, June. That was brilliant. Thank you for sharing your knowledge with us. And thank you, Dr. King, as well, for putting things in such an accessible way. If there's one thing I learned today more was about the huge team that it takes to help someone recover from spinal injury. So many people working together to improve health outcomes for these individuals. And you also explained to us a little bit about, I got to understand more about the world of someone that might live with this condition. So thank you so much with this kind of injury. Thank you so much. So just wanted to quickly share with you some of the things the CAN is doing, and also on just 1 second, my screen is very small today. Trying to share my screen. Yeah, that's perfect. And some of the things as well, some opportunities that exist at the moment for us. Perfect. I think you can see my full screen. So next week, very, very interesting session for Health Hour. We are here again Saturday at 11 a.m. And this session is about bowel cancer. We have Dr. Jama with us, and she will be sharing with us insights, certainly about treatment, management, and sorry, I'm having a technical issue right now. Am I still here? Can you? Sorry, my screen's up blaring. Apologies. I don't think you can see my screen anymore. Okay, we are back again. So we also have Healthy Hearts next week on Tuesday at 6:30 p.m. So a great time to join after work and join us with your cup of tea and get to know more about nutrition and relation to health. We are always graced by the presence of great Black nutritionists and specialists that will be sharing their knowledge with us. And we have a Healthy Homes conference soon on the 30th of August, so end of the month. We're really excited for it. It's facilitated by the Can Advocacy team, and you are invited. There is a QR code on the screen, therefore you can register to attend. It's completely free. It's going to be very interesting. Very important stakeholders will be there. So do come join us. I left a contact if you need more information on the chat. Do reach out. Victims Voice Panel recruitment. So this is a project that we're having for a second time. It was very, very successful. We're really making a change. So if you are passionate about making positive change within our community for in the lives of individuals affected by domestic violence, do join. We want to hear from you. Again, QR code is on the screen and also email on the chat. And there is plenty of opportunities that Can offers, particularly regarding research. So we have a focus group on stroke and fatigue. We just want to hear from you. There'll be interviews online and also focus groups. I must say that we give thank you remunerations for this kind of participation. So do get in touch with us. Research at can.org.uk or scan the QR code. So if you are an individual over 50 that is currently a smoker or an ex-smoker, we want to hear from you. It's very, very key. Research improves, again, health outcomes and improves, the future, not just of ourselves, but of the extended community, because research, as we know, brings new ways of treatment, management, and better clinical understanding of particular conditions. So do come along. There is a £50 thank you for this participation. So again, if you're a smoker or ex-smoker over 50, we want to hear from you. And I just wanted to thank you for joining us today, and I hope to see you all next week.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.